everyone. This is Dr. Matthew Hernandez from Ethos Integrative Medicine, and we're going to be talking about AC joint pain. So your AC joint is actually this joint right here where your clavicle meets your acromion. So that's A acromion, C clavicle, AC joint. And the acromion is part of your shoulder blade or your scapula. So if you follow your collarbone and until you get to your shoulder, you'll kind of feel like a bump. And that bump is going to be that AC joint. So what can happen here is if you have pain, what this pain typically presents like is it's pain in the front of your shoulder, so it goes down the arm this way. It's usually misdiagnosed as a biceps tendon problem or biceps tendinopathy. So if you had your biceps tendon treated, different things like that, and you're still having pain in the front, it's likely because it's an AC joint issue. The other telltale sign that it's an AC joint issue is you go and lift your arm up this way. As you lift up and you get past this 90-degree mark, the joint space here closes on itself, and if it closes too much, it can cause some pain to occur. So if you're lifting your arm up and that causes an issue, that could be an AC joint problem. Could also be rotator cuff, but that's another video. So just consider your AC joint with that regard. Those are kind of the two biggest things. And then one last way to test it, if you go and put your arm right across your shoulder and kind of lift your elbow up, if you try and push down, that motion there, when you're pushing down and you're resisting that motion, it causes pressure in your AC joint. If you have pain with that, it could mean that you have a problem there. Again, something you want to get checked out, go see a good doctor, have that looked at. That's what AC joint pain looks like. Now, how does it occur, right? So that's our next question. What caused it to occur in the first place? The pain's going to be from the AC joint is going to come from two different places. The first one is going to be the space in between your clavicle and your acromion. So there's an empty space there, and when that space becomes narrowed due to arthritis, due to instability of the joint, different things like that, then those bones can start to hit up against each other, and then that actually causes pain to occur. So joint space narrowing is the term that we use. So if there's joint space narrowing, that's going to be show that there's some arthritis in the joint. That'll cause some issues to occur. The second place where the pain can come from is the ligament. So it's the AC joint ligament that wraps around the joint itself. When you have an issue with that ligament, what can happen is it can get overstretched, where ligaments are supposed to be tight and stabilized. If they get overstretched, think of like a worn out rubber band. At that point, what ends up happening is it doesn't stabilize the joint anymore, and you can have that knocking of the bone again, and osteoarthritis develop in that area. So if a ligament gets overstretched, example would be, it's really common to happen like swimmers and different things like that, like overhead athletes, that when it gets overstretched, it causes that issue to occur. Ways to go and treat it. So the two biggest things would be, the biggest thing you need to do is stabilize the AC joint. So two things that lead to stability are going to be the muscle strength around the scapula or around the shoulder blade. If the muscles around the shoulder blade are weak, it can cause the shoulder blade to tilt forward, and when that tilts forward, it actually puts more pressure on the AC joint and makes it more prone for injury. So strengthening the muscles around the scapula, a really good physical therapist will be able to do that, and that'll help pull the scapula back and improve the stability of the joint. And then you could also do regenerative medicine as well. So prolotherapy, PRP are two really good treatments for helping improve the AC joint itself and the ligament. So if there's an arthritis issue, if it's a ligament laxity, you can go and do those treatments in there, and that'll actually help strengthen the ligament and improve the osteoarthritis and prevent them both from getting worse. If you do those combination, that's the best long-term result you can get. If you're looking for a short-term fix, you could do like a cortisone injection or a Toradol injection into the joint. That'll decrease the pain, but the chance of it coming back is pretty high. So that's something to consider. But if you're in a lot of pain, sometimes that pain relief is what you're looking for. Now, if you're watching this video and you're thinking, oh man, I probably have an AC joint problem, your next step would be to go contact a good provider that will help you accurately diagnose through physical examination, proper imaging if needed. That way you can be on your next steps to getting better. Hopefully that video was helpful for you. If you have any more questions on AC joint pain, go ahead and leave your questions in the comments below. If this video was helpful for you, if you don't mind liking and subscribing to this, I'd appreciate that. Have a great day, and thanks for watching.